Well, one person who had COVID-19 visited the casualty section at Netcare St. Augustine's Hospital, and 22 days later, the staff accounted for 1 in every 10 cases in KwaZulu-Natal. This happened at the start of our COVID-19 pandemic. It's how fast and efficiently a virus can spread, and in a hospital, a health facility. But the spread of a disease like this is not unique. Lessons can be learned from the spread of other highly infectious diseases in a hospital environment. Dr. Indira Govender joins us now. She's a clinical research fellow at the London School of Hygiene and Tropical Medicine, based at the Africa Health Research Institute. Dr. Govender, good evening to you. Thank you so much indeed for your time this evening. When we start trying to stop viruses from moving around in hospitals and healthcare facilities, we obviously need to protect workers in those facilities. Where do we start?
Well, I think you've heard already, Stephen, about the issue of wearing the correct personal protective equipment. So that's very important. In terms of occupational health, there are a number of controls. You have administrative controls, you have environmental controls, and then personal protective equipment is one of them. So administrative controls refers to how you manage that space, how many people are there, what kind of shifts they work, and how the flow of people and patients is organized. And then environmental controls refers to your things like ventilation, windows, doors, your equipment that is sterilized, and so on. So there's a number of aspects to occupational health and safety.
Is it expensive to do this? Does it require a lot of resources? And obviously different diseases move in different ways. But one of the problems that all health facilities here and in other countries will face is around the resources. Is it expensive to do?
I think if you're going to need additional resources, like in this case, we need more PPE, then it does become a question of cost. But I think making simple changes, such as just, managing crowds, waiting times, trying to keep people apart. Now that's a problem when you have small facilities that are used to allowing people to just wait there shoulder to shoulder. Now that's something that is going to require, behavior change. So not necessarily additional resources, but you might think about then putting chairs outside or building a sheltered space outside, but that still allows people to maintain a physical distance between them. I think a lot of this information people already have, at the facility level, and it's just a matter of tapping into that and understanding case-by-case situations.
There must be an issue around discipline, and let me just explain what I mean. If I were a healthcare worker working at 12, some people 24-hour shifts as a nurse or a doctor, there are going to be times when you're just like, for goodness sake, can I just go and do this? And I imagine if that discipline goes, and it's a highly understandable, very human thing to happen, that's really where the risk can lead. If you have people working very long hours, the chances of some mistake being made would grow.
Yes, exactly. That is also falls under the heading of administrative control. So it's ensuring that people work safe hours and that there's no fatigue that then leads to accidents and increasing one's risk of exposure. And unfortunately, with COVID-19, we're going to find a lot of that happening because as it is, our resources are stretched, and we hear that nurses in ICUs are being asked to work additional shifts on their days off because many of them are getting sick or because there's just so many patients. So really this is going to have, unfortunately, a snowball effect in terms of how our risks, especially for healthcare workers and then for patients.
We've been talking about COVID, we gave the example of what happened in Durban. This must have happened before in human history, I'm sure in the recent past as well, with other diseases.
The most notable one that we've referenced, because this was a focus of our research, is the outbreak of extensively drug-resistant tuberculosis that took place at in a rural town called Tugela Ferry in KZN about 20 years ago. But if you look through news reports, you'll find a number of cases about facility outbreaks of infectious diseases. The one that crops up a lot is Klebsiella. So, South Africa does have experience with this. It's just that when it's contained in a facility or in a unit at a facility, it's easier to investigate and then to manage. But now that we have a pandemic, it just makes it much more complicated.
Confidence is really important here as well, isn't it? I mean, to make sure that nurses and doctors feel confident walking into the hospital that they're going to work in. If you feel that confidence, the chances are also that you might just sort of remember, even if it is 3 o'clock in the morning and you're on your 700th patient, you might just remember to maintain the proper practices.
Yes, I mean, it's really important that healthcare workers are supported, that they have, strong leadership at their facilities, that there are debriefing sessions as well for them to air their concerns, and that their concerns are taken seriously. I mean, I think that is the only way you can really have buy-in, and this is very much a team effort because of the way this virus spreads. If one person is compromised, then your entire team is compromised, and then your facility and the patients that you're trying to serve become compromised as well.
Dr. Indira Govender, I really do appreciate the time, and good luck to you for the rest of this pandemic. Thank you very much indeed. Clinical Research Fellow at the London School of Hygiene and Tropical Medicine, and also based at the Africa Health Research Institute.